It passed 2 p.m. and I see workers busily ripping off roofs of buildings marked for reconstruction or renovation. Other structures like the medical and orthopedic wards have already been pulled down to ground zero, and I'm told that the accident and emergency unit is the next to be demolished. The Effiankwanta Regional Hospital has for decades served as the only referral facility for cases from as far as the Western North region before the regional realignment. The promise to renovate the hospital to befit the status of a teaching hospital has always been on the drawing board of successive governments, but the project has never seen the light of day. The ongoing works here, to many, is evident that this time the region is on the verge of getting its fair share of improved health care. Dr. Joseph Kojo Tambel is medical director of the Effiankwanta Regional Hospital.
Now, since late 2021, we've been on the design phase, preparation for moving to site and all that. And I'm happy to say that at this point, we're sort of kind of combining things. The various partners involved, that's Amandi. Amandi are the contractors. They are also the people who've gone to look for the funds. That's one party. The Ministry of Health, the Ghana Health Service, represented by those of us in management at Effiankwanta at the moment. Processes started from I think 2020, when the Minister of Finance took a proposal to Parliament about the redevelopment of Effiankwanta into a tertiary facility. The processes involved were so lengthy that approval was eventually given in 2021 when value for money audit was done and completed.
He explains that the project, which is in 2 components, will see the redevelopment of the hospital into a 200 to 500 bed capacity tertiary hospital, which will serve the Western region and beyond. A new regional hospital to be built will be situated at Apimenim in the Ahanta West municipality.
Okay, so the project, it has 2 components. One is the redevelopment of Effiankwanta from a regional hospital to a tertiary facility. And then there's a new hospital which is going to act as the new regional facility for the Western region. And that's going to be at Apimenim, near the Agonankwanta area. That's going to be a 250 bed facility. And Effiankwanta is moving from around 300 to about 500.
As part of the transformation project, staff to man the facility will be trained both home and abroad to equip them with their skills to manage certain cases and undertake surgeries which hitherto would have been referred outside the region.
What I gather from the developers, they're looking at a period of about 3 years. And mind you, it's not just the construction, there's also finishing, equipping and training, because they're going to bring in a lot of high-end equipment and all that. And the people who are going to use them have to receive training to be able to use them. So,
like the management and staff of the hospital, many who solely rely on the hospital for all their medical needs are excited that the project is finally becoming a reality. To residents of the region, it's better late than never, but they are hopeful and want to see work progresses on schedule.
It's a welcoming news for all of us, the Western region. This is our biggest hospital. It's been long overdue, and this is a welcoming news. It's a positive note to that effect.
I'm a mother of 2 children, and I gave birth to my children at Effiankwanta. And hearing that the hospital will be redeveloped into an ultra-modern facility to make it the center of excellence in health delivery in the Western region. And hearing this, all I will say is that God help them to do it and do it very well.
The first component of the project is expected to be completed within 3 years, although the land for Pimenim Regional Hospital project has been secured. It is not clear, however, when the construction will start. From Effiankwanta Regional Hospital, my name is Isaac Hughes, reporting from Sekondi in the Western Region.